secretary of the 49th sickest state in our nation. Many of the outcomes that that my people have are worse than in Central America and other parts of this globe, including the maternal mortality and infant mortality problem that we have. So we are ignoring the real problem. So let's stop chasing windmills and focus on really the fundamental issues we need to address, which are poor outcomes, overall increasing costs, lack of patient engagement, really giving states flexibility, real flexibilities we want, like negotiating drug prices, like being able to work with Medicare to not pay for low-value services, like thinking about shifting our funding into the social determinants, the fact that our zip code means more to our health than our genetic code. Those are the types of discussions that we need to have. They're existential discussions. They're discussions about our country's finances, the overall viability of our economy. We have to have that. Instead, what we're talking about are major cuts without any significant structural reform. And 72% of people in my state approve of the Medicaid expansion. Okay, but there are a lot of people that say Medicaid doesn't mean anything. It doesn't mean anything to have a card. It's useless. We know it's not useless. As a practicing physician, I know it's not useless for my patient to get a mammogram. So we made what I'm proud of, my staff did it, the best national graph of what happened to healthcare in our state. 440,000 people got coverage. 225 women got diagnosed with breast cancer. 24,000 women got mammograms. 30,000 people substance abuse and mental health treatment. Thousands newly diagnosed with hypertension, not going to have a stroke and not be able to work. And I said, but Senator, you've been saying that Medicaid is the illusion of coverage without the reality of care. What do you make of these real numbers? And and he didn't answer. Hep C, for example, we have 35,000 people under the purview of the health department that have this. Last year we treated 388. To treat them at the discount price, now this is an $8,000 price, it's discount, it's not the $80,000 out of the box Gilead price. To treat everyone would be $760 million. That would be double our expend for all of higher education in our state and 3.0 times the spend for K through 12 education. But that is not acceptable. It's impossible, and it's impossible calculus, and it's impossible as the population ages for the U.S. to pay whatever pharmaceutical companies want to charge, whatever that price is. And no matter what the value-based framework, we just don't have enough money. If you Google Louisiana budget allocator, you'll see that we created a map where you can, an interactive abacus, where you can plug in these numbers and show the externalities and the consequences of these prices. We cannot spend what we're spending on health in perpetuity and be internationally competitive. We've got to deal with the overall price, and we've got to deal with the drivers of that price. Medicare can't consider costs, right? So this is not, we've got to be able to deal with this. And we were talking yesterday about the history of the U.S. healthcare system, and at the time, the discussions were had over Medicare controlling costs were not going up that much. Well, now they are. We've reached that point. It's a tipping point. Medicare will not be around for me unless we change it for my generation. We've got to deal with the cost problem. We cannot ignore it anymore, but we've got to do it with real solutions, not by just saying, hey, listen, we're going to cut millions of people off of Medicaid to solve our cost problem. That is not the solution.